Hello and good morning. I'm Kevin Rychik, a fourth-year medical student at the Sackler School of Medicine, and I'm pleased to present a new Bladder-Diary Derived metric to quantitate voiding behavior in overactive bladder. Here are our conflicts of interest. I personally have none. Thank you to Dr. Bushman, Dr. Blaivas, and Dr. Weiss for the fantastic mentorship and guidance on this project. A 24-hour voiding diary is often used in evaluating patients with LUTS. It is self-evident that the majority of voids are smaller than the maximum voided volume, and the number of voids in 24 hours almost always exceeds what would be required if every void equaled the MVV. In simple terms, it may be stated that all persons void more often than their bladder capacity would predict. The reasons for these extra voids might include logistical, circumstantial, or behavioral factors. Patients with overactive bladder void more frequently than normal. This has been generally attributed to a diminished functional bladder capacity, but the contribution of extra voids has not been previously examined. The purpose of this study was to compare the number of extra voids in men and women with overactive bladder as compared to asymptomatic men and women, and then to examine how the number of extra voids is influenced by 24-hour urine output. This was an IRB-approved retrospective study of 400 patients, including 262 men and 138 women, diagnosed with overactive bladder between 2015 and 2019, who completed a 24-hour bladder diary and lower urinary tract symptom score questionnaire using a smartphone app. Exclusion criteria consisted of incomplete or erroneous diary entries. Diagnoses were made based on the lower urinary tract symptom score questionnaire. An overactive bladder subscore of 8 or more was considered a diagnosis of overactive bladder. We defined two new metrics. The voiding frequency index, or VFI, was calculated by dividing the 24-hour urine output by the MVV, and the functional bladder capacity index, or FBCI, is the difference between the actual number of voids in 24 hours, ANV, and the VFI. The FBCI is therefore a novel metric for extra voids between the theoretical minimum number of voids based on the MVV. Values for urinary output ANV and MVV and our two novel indices VFI and FBCI were calculated for each patient in the total sample, and additionally for asymptomatic men and women referenced from these two studies below. Now for our patient population. We had 400 patients, including 262 men and 138 women, diagnosed with overactive bladder between 2015 and 2019. 19 patients with incomplete or erroneous diaries were excluded. A total of 381 patients met the inclusion criteria for this study, including 251 men and 130 women. The mean age was 56.3 years, with the range being 14 to 93 years old. Next are our results. As you can see here in Table 1, in the comparison of voiding diary metrics between patients with overactive bladder and published reference values for asymptomatic patients. This was true for the total number of persons in both groups, as well as for both men and women considered separately. The VFI was greater in patients with overactive bladder compared to normal asymptomatic controls. This is as expected given the reduced bladder capacity represented by MVV in patients with overactive bladder. The FBCI was also greater in patients with overactive bladder compared to the asymptomatic controls. This analysis reveals that increased voiding frequency in patients with overactive bladder results from both diminished bladder capacity and an increase in extra voids. As you can see here in Table 2, in the comparison of voiding diary metrics between patients subdivided by 24-hour urinary output. Urinary output, ANV, VFI, and MVV were significantly greater in patients with polyuria and smaller in patients with oliguria as compared to patients with normal urine output. FBCI was significantly greater in patients with polyuria than patients with oliguria. These data show that greater ANV with increasing urinary output is associated with an increase in extra voids. All people, whether experiencing LUTS or not, void more often than absolutely required over 24 hours based on maximum voided volume, but this matter has not been studied previously. Through analysis of Tissot et al.'s data for asymptomatic patients, we established a baseline of extra voids in patients with outluts to be compared to those with overactive bladder in our sample. Those with outluts void an average of 3 times more than the minimum required by the VFI, and those with overactive bladder void an average of over 4 times more. Additionally, when comparing FBCI across urinary phenotypes, we found significance statistically and clinically. Most importantly, those with overactive bladder and polyuria void an average of over 5 times more than minimum. The single greatest limitation of this study is that the published data for asymptomatic men and women report only group values and limit the statistical comparison that can be performed. FBCI is a novel metric for the number of voids in excess of what might be predicted by dividing the urinary output by the MVV. This observation begs the question, are these extra voids a result of a conserved physiologic mechanism, i.e. the increase in extra voids is a built-in component of the increase in ANV, and is consistent both between men and women and consistent with different causes for an increase in ANV, like overactive bladder or polyuria. Or it could be due to an underlying pathologic process, or the result of the patient's attempt to minimize symptoms of urinary urgency. Thank you for your time, and I look forward to answering any questions you may have.